in.
Hi, is your name Gina?
It is.
Hi, I'm Michaela. I'm going to be your student nurse practitioner today. Can you tell me your name and date of birth, please?
Sure, it's Gina Pollock, and it's 4/3/1984.
Nice, and can you tell me where you're at right now?
In the doctor's office,
Okay, can you tell me what brings you in today?
a back to school physical.
Nice, and what time was your appointment today?
It was at 9 o'clock.
Okay, and it is 9 o'clock right now. So can you tell me what a head to toe assessment is?
So basically, you are going to give me basically look head to toe what's going on with my body.
Correct, so I'm going to start with your head and work way down to your feet and check each body system. Do I have permission to do this assessment today and record a video?
Yes, you do.
Okay, thank you. So according to Gina's general appearance, she is a middle-aged woman who is a short stature and of healthy weight. She responds to questions appropriately, cooperative, and maintains eye contact, seems to be in good spirits. Her hair is well groomed and her clothes are clean and appropriate for the weather. Her skin is correct for her race and her facial expressions express smiling or happiness. There are no body odors or breath smell during assessment. Patient sits upright, no discomfort or distress. Patient is appropriate and coordinated, has steady movements with no tremors or tics. The patient is alert and oriented ×4 based on questions asked prior. And I'm gonna go get her vitals. I came back and vitals read as BP of 116/84, heart rate of 88, respirations of 20, temperature of 98.6, height of 4'11", and weight of 132 pounds. Gina, are you having any pain today?
I am not.
Okay, so we're gonna move on to your head and neck area. I'm just gonna overall just take a look here at first. So I'm gonna assess your hair. So moving around her scalp here, I'm assessing for any lesions, any nits, any any traumas, any lumps, bumps, tenderness. Her hair seems to be distributed evenly. It's thick and full, and there's no pain, correct?
No pain.
Okay, so her head seems to be normal cephalic and size and smooth with no deformities, lumps, and bumps as well. Her face seems to have a normal facial expression. She is appropriate for the situation. Her face is smooth and symmetric, and she has no involuntary movements currently. Her skin is warm. Her color is of normal complexion. She is warm and has no discoloration. She has minimal acne lesions healing on her jaw area bilaterally, but no other rashes or facial hair seen. So Gina, I'm gonna start by assessing your cranial nerve number 7, which is your facial nerve. So I'm gonna have you do a series of movements here for me while looking at me, okay? So I'm gonna go ahead and have you raise your eyebrows for me. Perfect. Now I'm gonna have you close your eyes tightly, and I'm gonna try to open them. Don't let me. Perfect. Now can I see you frown? Smile. Can I see your upper teeth, your lower teeth, and can you puff your cheeks for me? Perfect. I'm also gonna take a quick look at your eyelids and eyelashes. So her eyelids seem to be symmetrical. They're not swelling. They don't have any lesions, bumps, or lumps. And there is no lagging or issues when she opens and closes her eyes. Now, all of her movements during the cranial nerve number 7 were symmetric and strong. So Gina, if that's okay with you, I'm gonna move on to your jaw and neck area now. So I'm just gonna palpate down your jawline here. Any pain?
No pain.
Okay, perfect. So I'm gonna have you open and close. Perfect. Clench your teeth. All right. So Gina does not have any swelling, redness, or tenderness. She has smooth movement, full range of motion of her TMJ joint. She has no crepitus or snapping or clicking. And that was assessing cranial nerve number 5. So we're gonna move on to your neck area. So I'm gonna have you tilt your head back a little bit for me. And I'm just gonna touch here. It's symmetrical, there's no lesions, no redness. Is there any tenderness here?
No pain.
Okay, so I'm gonna go ahead and displace your trachea here and go ahead and give me a swallow. Perfect. To the other side here. All right, and then I'm gonna palpate down again. Gina, I'm gonna hand you your water for some more swallows here soon. All right, so I'm going to assess your thyroid here, and I'm just gonna again palpate here and have you take a sip of water again. So here we go again. I'm gonna go ahead and palpate. Perfect. One more time. Perfect. So Gina's thyroid was not palpable or enlarged during swallowing or at rest. and it's non-tender, and there's no notes felt during palpitation. Gina, I'm gonna check your range of motion of your neck now. So what I want you to do is look at the ceiling for me. Perfect. Chin to your chest. All right, can you look to one side for me? And then the other. Perfect. Now, can you touch your ear to your shoulder? All right, other side. All right, can you do range it like a circle for me? Perfect, and you can go the opposite way. Okay, Gina has full range of motion of her neck area. So now I'm gonna assess her cranial nerve number 11, which is her spinal accessory muscle. So I'm gonna go ahead and put my hands on your shoulder here, and I want you to shrug. Perfect, and put your hand on your cheeks. I want you to look forward. Okay, look this way. Nice. So Gina's muscles are equal in strength and tone bilaterally. Her sternocleidomastoid muscle is also equal in strength and tone bilaterally. Patient neck again has full range of motion without pain and difficulty moving. So Gina, now we're gonna move on to your lymph nodes here. I'm gonna palpate your neck area just to check and make sure everything's going okay. So we're gonna start with her occipital lymph nodes here in the back. And then we're gonna go for her preocular, her postocular, her tonsillar lymph nodes, her mandibular, her submandibular, and her cervical chain, and then her superior clavicle nodes. Anterior superior clavicle nodes and her anterior superior clavicle nodes. All right, so now we're gonna move on to your eyes. Gina, I'm gonna have you stand over here and read a chart for me. Okay. All right, so I want you to cover, see me here. I want you to cover one of your eyes, whatever you choose first. Okay, perfect, your left eye, and I want you to read the smallest line for me. EPTZO. Okay, and I want you to switch to the other eye now.
CFDHJ.
Perfect. Now I want you to read them with both eyes.
CFDHJ.
Okay, so Gina, do you wear glasses or contacts, excuse me?
I wear contacts.
Okay, perfect. So Gina's right eye is 20/30, Gina's left eye is 20/25, and bilaterally Gina's vision is 20/20. You can have a seat for me. All right, so I'm gonna have you follow my pen light here, okay? I'm gonna draw a little picture. So I just want you to follow with your eyes only, okay? You ready? Perfect. Perfect. Now I want you to follow it through, close to you, eyes only. All right, good job. So Gina's visual fields are full, and she was able to maintain eye contact. Now I'm gonna go ahead and do a wiggle test. So I want you to cover the same side eye as me, and I want you to tell me when you see my fingers, okay?
Can see them.
Perfect.
Can see them.
Perfect.
Can see them.
Okay, other side, we're gonna switch.
Can see them.
Perfect.
Can see them. Can see them.
Perfect. All right. So now I'm gonna go ahead and pull down your lower eyelids here, and I'm gonna apply some gloves first because I'm gonna be touching your eyes and facial area. So during this assessment, I am going to be looking at your lacrimal glands, your conjunctivi, and your scrolla. So go ahead and palpate over here a little bit. Any tenderness?
No.
Perfect. Now I want you to look at me, and I want to pull your eyelids down. Go ahead and look at the ceiling for me. All right, look below, side to side. Okay, I'm just gonna check with my pen light here really quick. All right, so Gina's conjunctivi is pink, moist, and smooth. Tiny blood vessels were visualized but not enlarged. Her scrolla was white, clear, no swelling or discharge or nodules, and her lacrimal glands did not also have any discharge or swelling. So now we're gonna move on to your cornea lenses and your irises. So I'm gonna have you go ahead and look straight ahead, past my shoulder here, and I'm gonna use my tool. we're gonna assess one eye at a time here, okay? So first I want you to look over my shoulder. Okay. Perfect. And now I want you to look directly into the lens here. Okay. All right, we're gonna switch to the other side now. So I want you to go ahead and look over my shoulder again. Excuse me, I'm sorry that hit you. Okay, now I want you to go ahead and look straight into the light for me. Okay, perfect. Now typically I would turn the light off during this exam, but I cannot because you would not be able to visualize. So her corneas were clear, smooth, and transparent and intact. Her lenses were transparent and I do not visualize opacities. Light reflects evenly in both corneas. Her irises are flat, evenly colored, and symmetric, and her anterior chambers are deep and there are no shadows bilaterally. Now we're gonna go on and check your pupils here. So I'm gonna use my pen light here. I just want you to look straight ahead. Okay, so. Perfect. Perfect. Okay, so I'm gonna go ahead and do it one more time here. Perfect. I know, a lot of light in your eye one time, I'm sorry. So Gina's pupils are round, equal, and approximately 3 millimeters and symmetric. They react to direct and consensual light briskly and accommodate. So now I'm gonna go ahead and do the pen light again just one more time and just make sure your corneal light reflections are there. So one last time with the light, I'm so sorry. Perfect. Perfect. One more time over here. A little further away. Perfect. Gina's reflections are symmetric and in the same position in both corneas. Okay, so lastly, I'm just gonna have you go ahead and make a series of looks for me. So I want you to, just with your eyes straight ahead, look up, down, side, side. Perfect. No extra movements, or excuse me, all extra movements were intact in all directions. Her eyes move smoothly and there's no gazes, nystagmus, or lid lag. During this portion of the exam, when we assess the eyes, we assess cranial nerve number 2, 4, and 6. Unfortunately, we can't do the full assessment for the cranial nerve number 9 because you have contacts in, but I am gonna have you close your eyes here and tell me where you feel this light touch.
Forehead.
Perfect.
Cheek.
Okay.
Bottom cheek. Forehead.
Mm-hmm.
Cheek. Chin.
All right. So Gina was able to identify the locations, but again, we cannot test the full. We can't test the full cranial nerve due to her contacts. So now I am going to, again, I would turn the light off. Excuse me, turn the light back on. And I would, during all these assessments, I assessed her optic disc, which was pink. It had sharp margins, and her physiological cup bilaterally in both eyes was 0.3. They were symmetric with no edema. The retina showed normal visual and normal vessels, and were intact with the AV junctions. There were no hemorrhages, exudates, or masses. Her macula and vulva were visualized, and her vulval light reflex was present. Now, Gina, we're gonna move on to your ears, okay? So I'm just gonna take a look at first. So I'm just gonna pull them forward and back. Perfect. Again, pull them forward and back. Any pain?
No pain.
Okay, perfect. No lesions, lumps, markings, rashes noted. So now I'm gonna make a couple movements on your ear, and I just want you to let me know if you feel any pain. So, any pain?
No pain.
Any pain?
No pain.
And I'm gonna push your mastoid process. Any pain?
No pain.
Perfect. Now we're gonna do the other side. Up and back. Any
No
pain? Up and back.
No pain. No pain.
Perfect. So, there was no tenderness, nodules, or swelling bilaterally behind ears, on the side of ears, and as well as the mastoid process. So now I'm gonna go ahead and look inside your ears with my tool. here really quick. Alright. So I'm just gonna go ahead and check your eyes, your ears here, okay?
Mm-hmm.
Let me know if you feel anything. Perfect. Go to the other side here. Oh, sorry, I did not mean to raise you up there. Okay. So during this exam, I assessed bilateral tympanic membranes. Her color in her ears was translucent. Her contours were slightly concave. Her membranes were intact. Her malleus was visible, and she had distant light reflexes in both the right and left ear. So now, Gina, I'm going to assess your hearing. So there's a series of 3 tests that we do. Oh, I am so sorry. So sorry about that. So we're gonna start by I'm gonna have you cover one side of your ear, and I'm gonna whisper something in your ear, and I want you to tell me what you hear. Okay?
742.
Okay. Other side.
J27.
Perfect. So she heard bilaterally in each ear, correctly. So now we're gonna excuse me. So that assessed your cranial nerve number 8, which is your acoustic one. So now we're gonna move on to what we call a Weber's test, okay? And I'm gonna use a couple of tools for the Weber and the Rhine test. So let me grab those real quick. All right, so we're gonna start with the Rhine test here. So what I'm gonna do is I'm gonna hit this on a hard surface. I'm gonna put it on top of your head in the center, okay? And I want you to let me know if you hear it in your right ear, your left ear, or bilaterally, okay? All right. Perfect. Okay, so now we're gonna move on to the Rhine's test. So we're gonna use this tuning fork this time. And what I'm gonna do is I'm gonna again bang it, and then I'm gonna put it on your mastoid process here. And when you're done hearing / feeling the vibration, I want you to let me know. I'm gonna flip it over and put it in your ear, and I want you to let me know when you stop hearing that, okay? Perfect. All right, we're gonna switch over to the other side now. Okay.
Done. Done.
Okay. So Gina passed both the Rhine and the Weber's test because according to a normal finding, her the vibration in the back of the mastoid bone would be heard less or not as long as when you hear it in your ear, and that was the case for Gina. Okay. So now we're gonna move on to your nose. So I'm just gonna look at her nose in general. I don't see any lesions, any disformities, or any asymmetry. So now I'm gonna palpate. While I'm palpating your nose, I'm just gonna go ahead and palpate your sinuses too, so I'm not touching your face too much. So we'll go ahead and just tell me if you feel any pain in any of the areas that I touch, okay? Perfect, okay, and there's no pain felt there, right?
No pain.
Okay, so Gina's nose, it has no tenderness, no masses, and no pain during palpation. So I'm gonna have you occlude one of your nostrils, and I want you to take a deep breath. Perfect, now switch sides. Okay, Gina's nares are bilaterally painted. So now I'm gonna, well, I already had assessed your sinuses, so we'll just say that they're not swollen, no signs of sinusitis or anything crazy. We're gonna go on to assess your cranial nerve number 1, which is called your olfactory. So I'm gonna have you close your eyes now, and I'm gonna have you smell 2 things. I want you to tell me what you smell. So go ahead and close your right nostril for me. Perfect. I'm gonna whiff this, tell me what you smell.
Coffee.
Perfect. And then I want you to switch sides here. Go ahead and tell me what you smell.
Cinnamon.
All right, those are both correct. Good job. So Gina's cranial nerve number 1 is intact. Now, I'm gonna have you tilt your head back a little bit, and we are gonna check your nose with the light again, okay? So go ahead and check you out here. Perfect. Sorry about that. I'll be as quick as possible. I'm sorry that it tickles. Perfect. Okay. I'll make sure that doesn't fall on you this time. Okay. So after assessing Gina's nose with the scope here, her nasal mucosa is pink, moist, and symmetrical. There's no discharge, swelling, or bleeding. Her septum is midline with no deviations, perforations, or inflammation. Okay, so now we're gonna do something called a translumin test of the sinuses. So I'm gonna go ahead and grab my pen light here, okay? So I'm just gonna go ahead and place this above your eyebrow here. Perfect. Let me see the other side. All right, it took me a little second there. Perfect. Okay, now I'm gonna have you open up wide. I'm gonna place this in your sinus area. I'm just gonna check in your mouth. Perfect. One more time on the other side. Perfect. So, both her frontal and maxillary sinuses are transluted bilaterally. So now we're gonna move on to your mouth and pharynx. So I'm gonna go ahead and switch my gloves out since I've been touching everywhere and grab some new ones. Okay. I also need to grab a couple other things here while we're. Okay. So I'm just gonna go ahead and look at a few areas and surfaces of your mouth while I'm in there, so I don't have to be in there too long. Just go ahead and say ah for me. Perfect. Okay. So Gina's lips are pink in color, moist with no lesions or cracking. Her oral mucosa is pink with no areas of pigmentation or white patches or nodules. Her gums are pink in color with no swelling or bleeding, and her teeth seem to be intact with no teeth missing or abnormal positioning. Now I'm gonna go ahead and say, I asked you to say ah one more time. I'm gonna check your soft and hard palate and your pharynx. Go ahead and say ah one more time. Perfect. So her soft palate is pink and smooth, uvula is midline. Her tonsils are pink, moist, and symmetric with no ulcers. Her hard palate is also pink, smooth, and intact. Her pharynx is pink in color, moist, and symmetric with no swelling. Gina, one last time, I'm gonna have you stick your tongue out, and I'm gonna do a series of things here so we can just be done. But at first, I'm going to go ahead and have you stick your tongue out and move it to or up and down. Perfect. Up and down. Okay. Side to side. Okay. Now I just want you to stick it out and just leave it. Perfect. So during this assessment, we assessed cranial nerve number 12. Her tongue moves without any twitching or fine movements. Now I'm going to ask you to stick your tongue out one more time here. And her tongue is midline with no fasciation. So now I'm going to go ahead and check her gag reflexes. You ready, Gina? Okay, perfect. So Gina does have gag reflexes here. Which is assessing the cranial nerve number 9 and 10 during that assessment we just completed. So now with my gloves on, I'm gonna go ahead and grab a gauze, and I'm sorry, unfortunately, Gina, I have to grab your tongue for a sec here. So with my gauze here, I'm just gonna pinch the tip of your tongue here, smooth it around so I can grab my pen light and get a better look in here. Perfect. And I'm sorry, I'm just gonna go in there and fill your teeth really quick while I'm in there. Okay. All right. So, Gina's gums are firm and not tender. Her teeth are stable with them intact with no mobility. Gina did have gag reflex. And now we're gonna move on to respiratory, if that's okay. Perfect. So, Gina, just generally looking at you, you don't seem to be in any respiratory distress. Your rate is regular, your rhythm is normal, your depth is normal, you have no effort during breathing, your chest expansion was symmetric, which we already seen in a previous assessment. but we'll check again when we have you stand up. I don't see any retractions during inspiration. So Gina, I am going to ask you if it's okay if I take off your shirt, or you take off your shirt, excuse me.
I'm gonna decline.
Okay, so if it's okay with you, I'm just gonna go ahead and take a peek down, just to see if I see any rashes, lesions, lumps, bumps, or abnormalities, which I do not. Now, Gina, we're gonna measure something called your AP diameter and your lateral diameter. So I'm gonna go ahead and get my tape measure here, and if you can just, so your AP diameter is from your sternum here to your spine. So we're gonna go ahead and start doing that measurement first, okay? So start here, sternum, go ahead and go to your spine. Perfect, that's 20 here. And now we're gonna do something called your lateral diameter. And this is when we go from one side completely to the other, okay? Perfect, and that is 45. So Gina's diameter and our AP diameter and lateral diameter are appropriate because it's a 1-to-2 ratio, and Gina's AP diameter was about half the ratio of her lateral. So now what I'm gonna do is I'm gonna have you stand up, and I'm gonna check your chest expansion. I'll have you turn around here, and I'm just gonna have you take a deep breath. Perfect. Gina's chest expansion, or chest symmetric in breathing and inspiration, and has normal respiratory effort. So now, Gina, I'm gonna go ahead and palpate your back here. If you want to just turn this way for me here. Perfect. So I'm going to start at the top here and work my way down. I'm actually going to remove my gloves here just so we can hear it a little better. So we're going to go ahead and start here. Move our way down. Okay, I'm gonna have you turn around. I'm gonna do the same thing to the front of you. So go ahead with the palpations again. Excuse my reach here. One more time, excuse my reach. Perfect, now I'm gonna have you go ahead and have a seat. And now that we percussed, we're gonna go ahead and move on to listening, okay? So I'm gonna use my stethoscope here. I'm gonna go ahead and give the front of you a listen, and then we'll move to the back, okay? So with the diaphragm of my stethoscope, I'm just gonna go ahead and move down here. Excuse my reach. Perfect. One more over here. Go ahead and move to the other side here. Perfect. All right. So now what I'm going to have you do is I'm going to have you turn either with your back shoulder if you would like to stand up, and I'm going to listen to the back. I'm going to have you take a deep breath here with every place I move, okay? So I'll go a little slower. Take a deep breath. Perfect. Another one. Perfect. Another one. Another one. One more time. Perfect. Again. Move down lower here. Again, excuse my reach. Deep breath. Deep breath. One more time. Deep breath. Deep breath. Perfect. So Gina's breath sounds are heard throughout the lung fields. They're equal and bilateral. They're normal pitch and intensity, have normal duration of inspire and export phase. Breath sounds are clear bilaterally, and there are no adventurous sounds heard, so voice transmission test is not indicated. Now we're going to move on to the cardiac portion of this assessment. So unfortunately, this table isn't the best for a cardiac exam, so we're gonna make it work. So I am gonna go ahead and start by feeling your carotids and then listening for any bruits. So we'll start there. So I'm just gonna start on your one side here. Perfect. Go ahead and try your other side here. All right. And now I'm gonna go ahead and take a listen with the bell of my stethoscope here. Perfect. Okay. So there were no bruits heard in her carotid area, and her pulses were felt bilaterally and equal. So now we're gonna move on to something called the JVP area. So at first, I just want to go ahead and look at it. So I'm gonna have you, if it's possible for you to lean back as possible as you can, go ahead and turn to the other side for me. I want you to take a deep breath and hold it. Perfect. Okay, so if you could just stay there for a second, I'm gonna go ahead and measure this now. I'll make it as quick as possible. So, go ahead and palpate from your midclavicular line, 5 intercostal spaces. Place this here. Now I want you to do it one more time for me. I want you to go ahead and take a deep breath. Perfect. So Gina's JVP is measuring at 6 centimeters. And now we're gonna go on to listening to the heart. I'm gonna use the diaphragm of my stethoscope starting. So we're gonna start on your left side here, okay? So we're gonna listen to the aortic valve. We're gonna move over to the pulmonary valve, excuse me. Then we're gonna move down to the Erb's point. Then we're gonna go down the tricuspid valve. And then the mitral. Excuse my reach again. Perfect. Then I'm gonna go ahead and switch my stethoscope over while I'm already here, and I'm gonna listen to her apex. Nice. And then I'll listen to her base. Okay, so Gina's heart rate was normal at 88 beats per minute. Her rhythm was regular. There were no extracurricular sounds heard and no murmurs heard. Her S1 was heard louder at her apex. Her S2 was heard louder at her base. There was normal intensity of her lung sounds, and there was splitting of S2 heard on inspiration, but no other extra sounds or splitting. So now, Gina, I'm gonna clean up my supplies here and get all this junk out of the way, and then I'm gonna go ahead and have you lay flat for me, okay? So just give me 1 second while I clean up my mess here. Whichever way you feel comfortable in. So I'm gonna start, if you don't mind, I'm gonna expose your belly a little bit. And I'm gonna start by listening. Okay, so I'm gonna listen with the diaphragm on my stethoscope here. I'm gonna start with your right lower quad. Perfect. Go up to your right upper quad. Then your left upper quad. Then your your left lower quad. Perfect. So Gina's bowel sounds are present in all 4 quadrants. There were about 5 to 15 sounds heard during that, with gurgling, soft, and character. So now I'm gonna go ahead and listen again to your arteries in your stomach. So you have an aortic artery, 2 renals, 2 iliac, and 2 femoral. So I'm gonna use the bell of my stethoscope to listen to those. Switch over here. So start with, I'm so sorry. Start with your aortic here. Perfect. And move over to your renal. Your other side here. Now we're gonna move down to your iliac. I'm gonna have to fix your pants a little bit. Other side here. And then you're gonna go down to your femoral area. All right. Perfect. So there are no bruits heard on the aorta, renal, iliac, or femoral arteries bilaterally. So now what I'm gonna do is I am going to have you take a deep breath for me, and I'm gonna listen over both your liver and spine, spleen, just to see if I hear anything with, so I'll tell you when I'm ready here. So we're gonna start, with your spleen over here. Go ahead and take a deep breath for me. Perfect. Now we're gonna go over to your right side. Take a deep breath for me. Perfect. So there was no venous hums or friction rubs heard during that assessment, listening to both organs next to each other. Next, what I'm gonna do is I'm gonna do some percussions. So I'm just gonna listen down both sides of your belly here and determine where your liver is based on palpation. So I'm gonna go ahead and start with your right side here, Gina. I'm sorry, percussion. Gina, if you don't mind, will you place your finger right there for me? Perfect. Keep going here. All right, so what I'm gonna do is I'm gonna, forgot my measuring. Sorry, I have to tap it one more time just to find this second area of dullness here. Perfect. So what I'm gonna do, Gina, is I'm gonna measure your, and I got 8 centimeters here. So the liver span is measured from the right midclavicular line to 8 centimeters. Now we're gonna check for splenomegaly. So I'm gonna go ahead and move over and palpate. You can move your hand, Gina, that's perfect. I'm gonna go ahead and palpate your spleen area now. I'm sorry, percuss. Okay. So I hear dullness up here, but I don't hear any dullness anywhere else. Okay. So now what we're gonna move on is to palpation. So I'm gonna go ahead and palpate lightly and then deeply, and I want you to tell me if you feel any pain, okay? So I'm gonna start in your right lower quadrant. Okay, perfect. All right, now you're gonna feel my touch a little heavier this time.
No pain or tenderness.
Perfect. Just let me know if you do feel anything.
No.
All right. So during palpation, both light and deep palpation, there was no tenderness, rebound tenderness, or noted guarding. There's no masses felt. Again, I felt the liver edge here, and we're gonna go ahead and palpate your kidneys now. So what I'm gonna do is I'm gonna stick my hand under your back here and on your stomach, and I want you to take a deep breath. Perfect. Now we're gonna go ahead and move to the other side here. Take a deep breath. Perfect. And her kidneys were not palpable, which is a normal feeling. So now we're gonna move on to something called the costovertebral angle tenderness. So I want you to go ahead and sit up for me, or even stand up, and let me see your back here. Okay. So what I'm gonna do is I'm gonna place my hand on your back here, and I'm gonna give it a little tap, and I want you to tell me if you feel any pain, okay?
Okay.
Okay.
No pain.
Okay, so her costovertebral angle tenderness bilaterally was not noted, which is a normal sign. Now while you're standing, Gina, I'm just gonna have you lift your shirt up, and I'm just gonna check some light reflex touches here. Perfect. So during that assessment, her abdominal reflex were present and symmetric in all 4 quadrants. Now, Gina, you can have a seat. We are going to move on to assessing your upper extremities. So your upper extremities go from your shoulders to your fingertips, if you could imagine. So I'm gonna go ahead and just first assess those areas, and then we'll move on. So I'm looking at Gina's skin. There's no lesions, abnormal skin coloring, discoloration, masses, disformities in either side here. Actually, Gina, I'm gonna leave your sleeves up so when I check your pulses here, it's easier. Okay, checking down, there's nothing abnormal here. I'm checking her fingers, no cyanosis. I am gonna check for cap refill bilaterally, so less than 3 seconds. Less than 3 seconds, perfect. Now while I'm here, I'm just gonna go ahead and check your brachial pulses on both sides and your radial pulses here. Perfect. And on the side, I'm gonna go ahead and check your your lymph nodes over here, which are called your epitrochlear lymph nodes. And do you feel any tenderness here?
Okay, no tenderness.
Okay, perfect. Now we're gonna go ahead and switch to the other side. So I'm gonna check your brachial pulse again. Perfect. We'll check your radial pulse now. Perfect. And again, we're gonna check those lymph nodes on the side. Any tenderness or pain over here?
No tenderness or pain.
Perfect. So Gina's upper extremities were symmetric in size, no swelling or deformities. Her position was correct. Her contours were normal bilaterally. Skin was appropriate. Nail beds were pink, and her cap refill was less than 3 seconds with no clubbing. And her lymph nodes were not swollen or tender on each side. Both brachial and radial pulses were +2 with regular rhythm and equal in strength with no tenderness. So now, Gina, we're gonna move on to some palpation here. I'm gonna start with palpating your shoulder. So I'm gonna get up on this table a little bit here. So on your shoulder here, you have lots of joint areas and ligaments. So we're just gonna go ahead and palpate one by one here. So we're gonna start with your sternoclavicular joint right here. And then we're gonna move on to your subspinous, I think that's how you say it. Your acromioclavicular joint is right here. Your acromion is right here. Your corticoid process is right here. Your infraspinous is down here. Your bicep tendon is right here. And your teres minor is back here, underneath your shoulder, right there. Okay, so now we're gonna move on to palpating your elbow area here. Can you just raise it up for me? Okay, perfect. So back here is your ulnar nerve, so back in here. Okay, and this is your opramium process. Right in here, in this area. And then this is your, medial epicondyle, and this is your lateral epicondyle in your elbow here, okay? So now we're gonna move on to your wrist and hands. So we'll start with, we'll just do your anatomical sniff box. So would you just bend your thumbs back like that for me? You see that little box right there? Perfect, and I see the other side there. All right, perfect. So on your hands here, you have what we call distal interphalangeal joints, which are at the top here. Then you have your proximal interphalangeal joints right here. And then you have your metacarpal phalangeals right here. Your metacarpals are right here. Your carpals are right here. If we flip over here, we have your distal radius, and your ulnar right here again. All right, so all bony landmarks, muscles and tendons and ligaments in your shoulders, elbows, wrists, and hands were palpated bilaterally with no swelling, tenderness, or bony enlargements indicated. So now we're gonna move on to range of motion, Gina. So can I have you stand up for me? We're gonna check your range of motion of your upper extremities. So I want you to do what we call, we're gonna do a flexation of the shoulders. So put your arms up. Then we're gonna do an extension. Then we're gonna do an abduction, which is away, an adduction, which is close to the body. Perfect. Then we're gonna do an internal rotation, and then an external rotation. Perfect. So now we're gonna move on to the elbow area. So I want you to give me some flex, okay, extension, and then I want you to cup your hands and do up straight ahead supination and pronation. Perfect. Right. So now we're gonna do your wrists one last time. So we're gonna do flexation, extension, and then we're gonna do radial deviation and ulnar deviation. Perfect. So now we're gonna move on to the hands with the thumbs going first. So I'm gonna have you flex your thumbs inward, and then I want you to extend them outward, and then I want you to abduct your thumb away from your hands, and then adduct, bring it to your hands. Perfect. And then I want you to do opposition, which is when you touch your pinkies to your thumb. Perfect. Now one last time for your fingers, we're gonna do flexation, extension, abduction, adduction. Perfect. All right, you can have a seat now. So Gina's shoulders, elbows, wrists, and hands had full range of motion bilaterally, and the movements were smooth and symmetrical. So Gina, now we're gonna move on to your lower extremities, and I'm actually going to, excuse me, put on some gloves. All right, Gina, so what I'm gonna do is I'm first gonna inspect your lower extremities. So your lower extremities is what we just defined as from your groin to your toes. So anywhere in between is your legs, your hips, your knees, and your ankles. So just going around, Gina has pants on, so I can't really see much of her skin, but I'm assessing her skin for what I can see here. Yeah, you can take off your shoes if you like to make it a little easier. Excuse me. So I'm gonna go ahead and just palpate here. While I'm down here, I'm gonna check her her pulses in her lower extremities. So I'm gonna start with her dorsus pedis, sorry, excuse me, on each foot here. Dorsalis pedis, excuse me. And then I'm gonna go ahead and move on to her tibial pulses on both sides. Perfect. And then I'm gonna do her popliteal pulses bilaterally. So can I have you scoot a little bit forward, honey? Perfect. All right. And then while I'm up here, excuse my reach. I'm gonna go ahead and just check your femoral pulses and your inguinal nodes here, your lymph nodes. You have any pain or tenderness in here?
No pain or tenderness.
Okay. Please excuse my touch. All right. So her pulses were all +2 equally on both extremities, and her inguinal nodes were not tender or swollen. So now what we're gonna do is we're gonna move on to some palpation of the hip. If you want to stand up for me. Okay. So sorry, Gina. So right here is your iliac crest here, and then in the back is what we call a sacroiliac joint. It's like off to the side of your what I call so you have like a bone here. It's off to the side on each side, and then you have your anterior iliac spine, which is below here, and your posterior iliac spine, and then you have your great trochanter, which is also your femur, and then you have your trochanter busha, which is down here. Okay. So now we're gonna move on to your knee. If you want to sit down, that's what we're gonna do. Your knee and your foot. Okay. So in your knee, you also have several joints and ligaments. So we're gonna go ahead and palpate a few. So up the top here is your lateral tibial condyle, and then down here is your medial tibial condyle, and then right below that is your medial meniscus, and then your lateral meniscus here on each side, and then you have your suprapatellar busha, then you have your patellar busha around down here, and then your synovial cavity is right here, okay? Then moving down to your foot here, you have your Achilles tendon right here, you have your medial menalis, you have your calcaneus is at your heel, then right a little bit above that is your plantar fascia, and then in the top of your toes here, well not top, but over here in these joint areas is your metal phalangeal joints, and then in between these crevices right here that you feel me pushing on are the grooves of the heads between your metatarsals. I'm just gonna check both sides here, and I may need to turn the camera down a little bit so you can see. I'm just palpating her area, her Achilles tendon, her cantilus, her plantar fascia, her metatarsal, her metal phalangeal joints, and her groove spots. Okay. All right, so moving on now, we are we did not see any swelling, enlargement, tenderness, or bulginess in your hips, knees, ankles, and feet. So I'm gonna go ahead and have you stand up now, and we are going to do some range of motion exercises with your lower extremities. So first, I want to have you do some flexation of the hips. So I want you to put each leg forward for me, one at a time. Perfect. I want you to go ahead and put them back. Either side. Perfect. Then you're going to do abduction, which is out. Switch sides. And adduction, just cross. And across the other side. And then you're going to do an external rotation, so you turn your feet out the other side. Then you're going to do an internal rotation, turn them inward. Perfect. All right. So now we're going to move on to your knee. So we're going to do we're going to flex them up. Perfect. Then we're going to extend them out. Perfect. And then I want you to do an internal rotation. So I want you to point your knees inward. Perfect. And then go ahead and do the opposite outward. All right. Then next we're going to do your feet. So if you would, or your ankle, I should say. So if you would like to sit back down, you can. So we're going to do a dorsal flex of your first foot, then a plantar flex, then an inversion. So I want you to point it inward. Perfect. Then an exversion, outward. Switch feet. Now we're going to do a dorsal flex, plantar flex, inversion, and exversion. Perfect. Thank you. Thank you. While I'm down here, I'm gonna have you take your shoes off here. I'm gonna touch the bottoms of your feet and see how your toes react. Is there any reason why I wouldn't be able to touch your bottoms of your feet here?
I have a sore on my left foot.
Okay, so I won't touch your left foot here, but I will touch your right foot. So here we go. Perfect. So one more time with your toes here. We're gonna do a little bit of a work up here. We're gonna squeeze them in. I'll use my hands so just so you see. Squeeze them in for flexing. Extend them out for extension. Perfect. And I want you to spread them out for abduction, and then just leave them regular for adduction. Perfect. Perfect. So Gina has full range of motion bilaterally. Her movements are smooth, coordinated, and painless in all of her lower extremities, including her hips, knees, ankles, and feet, and toes. Her reflex at the bottom of her foot, her toes did curl inward, but her Babinski reflex was negative. So now, Gina, I'm going to have you set up for some coordination and sensory tasks here, if you don't mind. Okay, so what I want you to do is I want you to walk to the wall and then come back. Perfect. Now, if you would like, I want you to turn around and do heel to toe walk, if you know what that is. Perfect. So now can you hop in, or you can come back forward to me. Will you hop in place for me? Perfect. Do you know how to shallow knee bend? Perfect. And then what I want you to do is put your heel to your shin, and then just keep switching that back and forth if you can. Perfect. All right, now I'm gonna have you sit down. Actually, no, before I have you sit down, I'll have you do one more thing, stand up so you don't have to stand up again. I want you to close your eyes and place your hands forward for me. Perfect. Now you can sit down. So I'll have you put your extremities on your thighs, or excuse me, your hands on your thighs, and I want you to flip them back and forth for me. Perfect. Okay. Now can you squeeze my hands? Perfect. All right. Now, all of your movements were normal. You had great gait. It was very coordinated, and your strength was bilaterally the same. So good. That's good to note here. So now we're going to move on to what we call sensory testing. And I'm going to have you close your eyes here, and I'm going to touch you with different objects. And I want you to tell me if the touch is dull or sharp, okay? So I'm going to grab my tools here. All right, so I'll have you close your eyes. All right, and I'm just going to raise your sleeves up here just so we can give some variation in touch here. All right, so can you tell me what that is?
Sharp.
All right, and can you tell me what that is?
Dull.
Perfect. And now we're going to do something where I put two objects in your hands, your eyes are closed again, and I want you to tell me what you feel, okay? And what hand. So I'll start with putting this in this hand.
A key in my right hand.
Perfect, okay, I'll take that from you. Then I'll put something in your left hand.
Paperclip in my left hand.
Perfect. Now I'm gonna do something where I draw something on each of your arms with your eyes closed, and I wanted you to tell me what you feel.
8,
Perfect.
5.
Perfect. So all of Gina's sensory testing was normal. She had no signs of stenosis or abnormalities in each extremity. So lastly, Gina, what we're gonna do before we end this assessment is we are gonna check all of your deep tendon reflexes, okay? So we'll start with your upper extremities and then we will move our way down. Let me just grab my tool really quick here and I'm gonna remove my gloves again. All right, so I'm gonna start with your bicep area, and everything I'm gonna do on both sides here. So I'm just gonna have hold your arm out straight here. I'm gonna go ahead and give you a tap. Perfect. I'll do the other side here. And what you're looking for is a reflex or a bounce in your arm. Perfect. So now we're gonna move on to your tricep area, which is right above your ulnar nerve here. So we'll go ahead and give you a tap. Perfect. We'll go ahead and do the other side now. Okay, and the last is your brachioradial pulse, deep tendon reflex here, and it's about right here, right underneath the nerve. So we'll go ahead and give it a tap. Tap here. Perfect. That's what we wanted to see here. Then we'll go ahead and give it another tap here. Perfect. All right. So now we're gonna move on to your ankles and your knees. So what we call this is an ankle knee jerk. And I'm just gonna go ahead and tap on the inner parts of your knee and then behind your leg here on your Achilles tendon area. So, right, go ahead and tap one more time here. Perfect. Here. Perfect. All right, so now I wanna check the back here. You're gonna go and tap. Perfect. Tap again. All right. And that completes my assessment. Do you have any questions for me?
I don't.
Well, thank you for your time. It was a great assessment. Everything was normal, and I hope you do great in nursing school.
Thank you so much for taking your time to assess me.
No problem.